Hello everyone, and welcome to part 2 of our lecture. So we're looking at what causes substance use disorders. Now there are many other perspectives. I know some people take the hardline stance of, well, these people took the drugs and they're paying the price of their actions. But remember, this is why we need to eliminate that stigma that comes along with drug use, because a lot of people use drugs and only certain people become addicted. So we're trying to see what makes those people different. What influences make those people more addicted? Remember our diathesis stress model where we talked about someone's propensity to develop a drug use disorder? Let's look at, I don't know why I just pointed. I just pointed to my screen when you all aren't here. But the diathesis stress model looks at our predisposition or vulnerability to obtain a disorder, in this case substance abuse. So inherited predisposition, we found some genetic links to substance use disorders. Then we have our environmental factors, so the stress. So we have the diathesis, and this is a stress component. So prenatal trauma, childhood abuse, family conflict, significant life factors are all things that can play into someone's propensity to develop a disorder. So in the case of substance use, maybe someone doesn't have an inherited predisposition, but the stress factors in their life are so seemingly insurmountable that they turn to drug use. Or maybe someone has a strong diathesis and a low stress level, and it kind of sparks the disorder within them. So remember that. We have to eliminate that stigma because it can kind of lead itself to attitudes where we can't talk about these issues, or we can't have these people approach us. You'll see in the TED Talk video I put in our supplemental resources, we talk about how the stigma eliminates people's ability to come forward to talk about their substance use disorders, right? And so we don't shame people necessarily when they have a heart attack. Now, maybe at some level we do, but not the extent that we would for a substance use disorder. Like if someone passes away from a heart attack, we say, oh, that's so sad. They were so young. They did this, that. But when people pass away as a result of substance use or have to go to rehab, there's a shame that's attached to it. And so we have to eliminate that stigma so people feel free coming forward to, discuss their issues, to seek help. And also maybe even some countries utilize clean needle exchanges. So if people are going to use drugs, how can we prevent the transmission of other diseases such as HIV by offering them clean needles if they're going to use these substances anyway? So a lot to unpack there. But let's go back to sociocultural views. This is important because people who are more likely to develop these substance use disorders are living in stressful socioeconomic conditions. So our TED Talk video for our discussion board, Dr. Hart talks about these people don't have resources or alternatives, and sometimes the stress of life may lead someone to, want to escape it. Drug use has been utilized even in historic times to talk about, to try to escape real life and the dangers that come and to cope with those different experiences. And so when we're looking at drug use, people have used it as a form of escapism. We're looking at milk of the poppy, if you're into the Game of Thrones kind of thing, as well as mushrooms or psilocybin mushrooms have been used by different tribes, especially Native American heritage, to kind of call on the spirits. So sometimes these drugs have been used as a part of religious ritual. So sociocultural views can heavily influence our perceptions of, substance use as well as the disorders. I know that was a big tangent to say what I'm about to say. But also, families that value or tolerate drug use, people are more likely to engage in substance use if they are dealing with that type of family dynamic. So for example, if someone whose parents use alcohol very casually have a party, sometimes they may allow their underage children and their friends to have a party in their house because they assume it's going to happen and they enable it on some level, right? And so having families that value or tolerate that drug use may make us more likely to develop a substance use disorder because it's seen as acceptable. And it's just stress in general, we find that it can kind of trigger substance use disorders. Of course, we have psychodynamic views that look at childhood trauma, display substance abuse personality traits, as well as powerful early years dependency needs. So it's kind of, again, it's kind of hard to substantiate some of these psychodynamic views, whereas socioculture views have been heavily studied. We look at a whole slew of factors on how our society shapes people in their substance use and abuse, and how our views on these issues can affect someone's use or potential use. Again, psychodynamic views are a little harder to substantiate. Cognitive behavioral views are going to look at, you guessed it, our cognitions and our behaviors and how they relate to substance use. So people who are more likely to develop these disorders, they may have been operantly conditioned, okay, they may have been reinforced to use these drugs. Remember we talked about conditioning, positive punishment, positive reinforcement, negative punishment, negative reinforcement. Well, that tension reduction, there's a rewarding effect to using drugs, right? When someone consumes alcohol to suppress negative emotions, those negative emotions, we're taking away that tension. It's a negative reinforcement. It's reinforcing the behaviors because of its effects on the cognitions. So, and then we kind of expect that reward later. As you'll see with this, rewards produce expectancy. We expect that substance will be rewarding later, and we can turn to it in that same time of need. And this can also be influenced by classical conditioning. So if you have a certain group of friends who you frequently use drugs near, they become a kind of cue, because classical conditioning states that we associate those stimuli. So drugs or drug use with a certain group of people. And that's why often therapists will recommend that people who are recovering from drug use don't contact their former groups or people who are still using, kind of cutting off that association and that cue. We also look at biological views. Twin studies I talk about extensively in my developmental psychology class. But twin studies, basically, we're looking at identical twins, monozygotic twins. They come from the same egg because genetically they are the same person, right? There are differences, obviously, but in terms of genetics, they are the same. And what we found with identical twins is there's a high prevalence rate if one has a substance abuse disorder, specifically when we talk about alcohol abuse, there's a higher chance of the other one having it as well. Okay? Even in cases, right, and you may say, well, Miss Elizabeth, that might be the environment they're raised in. True, but it could also be a genetic predisposition, because we've also seen that in a biological parent-child connection where the child has been adopted by another family, if the parent was had alcohol abuse issues, the child is way more likely to develop alcohol abuse issues. So we're seeing a type of genetic component that could undermine, that could support some of these theories. So I don't want us to blame genetics, and I don't want us to blame the environment, because we always look at a mix of both. And it could be issues with neurotransmitters, because those psychoactive drugs are affecting our neurotransmitter activities. And depending on the drug, as you've seen, as you've gone through your reading, it could have different effects, like SSRIs. We're going to talk about selective serotonin reuptake inhibitors. They're trying to encourage our body to take in more serotonin. And so different neurotransmitters are going to be affected by different substances. Alcohol mimics GABA, which is an inhibitor neurotransmitter. And when it does that, it lowers our inhibitions, okay? And also brain circuits in our reward centers are highly reinforced through different drug use. And also gambling, because we talk about gambling in our text, can have some of the same effects as these other addictive type substances that affect our pleasure pathways. A lot of it has to do with dopamine. That's going to be your key neurotransmitter that affects those feel-good feelings, right? And those drugs can stimulate our brain structures directly and indirectly. That's important to know. And so we have a lot of different biological views that look into the specifics of how those substances affect our disorders. And one of those is kind of looking at, it's not really tolerance, but think of it as the opposite. Incentive sensitization theory. Sorry, I can't speak sometimes. But when substances repeatedly stimulate the reward center, kind of like when we talked about back with anxiety disorders, when children have anxiety in youth, it kind of rewires their brain to be hypersensitive to future anxiety and future stress encounters. The same kind of thing happens with our brain and those hypersensitivity to those different substances. And one of the most important is that developmental psychopathology view, which looks at substance use disorders and how those genetically inherited predispositions, how those stressors throughout childhood, how inadequate parenting, because sometimes permissive parenting or tolerant drug use, parents who tolerate drug use, how that affects the propensity someone will develop misuse or use issues. Reward substance use experiences, relationships with peers who use drugs. It's like a culmination of all of these other perspectives that we're talking about. Biological, cognitive behavioral, psychodynamic, developmental psychopathology view kind of blends those all together to paint a well-rounded picture of substance use in the individual. We talked about the diathesis stress model. So how do we treat substance use disorders? Because as we may know from personal experience, it is very difficult. There's a movie with Heath Ledger called Candy. It's a really good film about heroin use. And I think the line in the film says, when you can get off the drug, you don't want to. And when you want to get off the drug, you can't. So I think that's a very powerful statement on some people's belief that, it's for fun. And that's why a lot of people can casually use it, but sometimes it can progress to substance use, and you don't really know whether you're going to be more casual with the drug use or could possibly develop a use disorder until you take it. You may have a bunch of, kind of not pre-existing conditions, but different life stressors. Maybe you have a parent who's an alcoholic, so you understand, like, I do not like alcohol, I don't want anything to do with it, because that's what I found in my personal experience with people with parents who have substance use issues. Maybe they don't want anything to do with the substance, or maybe they repeat the pattern that they've seen when they're younger. It really depends on the individual. But the value of treatment is hard to determine because, again, we're looking at what's the best treatment for this person in this moment in time for this disorder. So different substance use disorders pose different problems. Some substances are physiologically and psychologically addicting, whereas others are just physiologically addicting, whereas others are psychologically addicting. So we have to determine what is the best treatment. Many people who have substance abuse patterns drop out of the treatment early. I know my cousin, she's been, I'm going to use her as a case study, just to give you a real life example. She has, I don't even know. She has 5 children. 4 of them have different fathers. No shade, that happens sometimes, right? As a result of her activity and drug use and risk-taking behaviors. And so what we've seen is that her treatment has been a revolving door. She's been in and out of therapy. She hasn't been able to fulfill her role as a mother. So my cousins have been adopted by my aunt. And so it's kind of a difficult situation because it's kind of generating that intergenerational trauma. And so I just wanted to give her as an example because treatment can be quite difficult. Unfortunately, she has not gotten treatment in the 20 years that she's been dealing with this. But that's not always the case. Some people can overcome it. She has a lot of trauma in her background that may lend itself to, it being more difficult for her to wean off of the substance. And so it can depend on the person. What's their background? What's their trauma? When did they start? How long have they been on drugs? She's been on heroin for as long as I can remember. And so, the duration of symptoms, the duration of use, these are all factors that therapists have to look at in treating someone. Some people can recover without any intervention at all. I've heard stories where people just said, one day I hit rock bottom and there was nowhere to go but up, right? And I wish that were the case for more people. And different criteria are going to be used by different clinical researchers, so it's not really systematic. There are systematic guidelines, right? Therapeutic approaches that are systematic amongst APA psychologists. But, sometimes we have different treatment that may be religious focused. Like Alcoholics Anonymous is very focused on a religion, but I think they've developed a more secular type of program. And then we can also do psychodynamic therapies, so helping clients become aware of and correcting those underlying needs. Because remember, psychodynamic, we're looking at those unconscious forces and conflicts in our life related to drug use. Psychodynamic therapies are probably coupled with other therapeutic approaches nowadays, especially CBT. CBT seems to be like the gold standard as we're going through this text because it's addressing both the cognitive and the behavioral components. So, the thoughts and the actions. So aversion therapy. So sometimes conditioning people to be averted to a certain source. So maybe this could be switching a substance with something that makes them throw up, right? So that they learn to associate, instead of thinking it's alcohol, it's going to be the thing that made them throw up. Contingency management, relapse prevention training, and acceptance and commitment therapy. All important approaches that cover both the cognitive and behavioral components. And then we have sociocultural therapies. Like I said before, you could have someone who's in a crappy situation, right? And they need therapy, they need help. Pardon my unprofessional term. But if you take that person out of their crappy situation and they get therapy, they're feeling good, they're feeling better. Then you put them back into the crappy situation, it's not going to do as much good as helping the people in that situation all understand and develop that social support. So looking at the psychological problems, where they emerge in the setting, maybe you discover a really toxic relationship between that person and their mother or their father, right? That can give you context to help work through their substance use issues. And lastly, biological treatments. So this helps people with a physiological addiction component, so withdrawing, abstaining, or maintaining. Detoxing, that's what it's commonly known as, but detoxification. So this is medically supervised withdrawal from a drug. So the person is being watched over by a medical professional to ensure that basically they don't have the possibly deadly effects of withdrawal. So sometimes, like we said with the earlier example, using, I think it's called methadone, so synthetically produced opioids to imitate heroin, to wean people off of heroin. And using antagonist drugs. So antagonist works counter. So think of antagonist as counter. An antagonist to a story is kind of like the villain. In this case, it's supposedly the good guy, right? But it's intended to help a person resist falling back into a pattern of substance abuse or attendance. So think of a drug that tries to counter the effects of the drug. I know rapid detoxification. I don't think this is the same, but correct me if I'm wrong. I think an antagonist drug would be like Narcan for people who overdose. Like if you see someone who's overdosed from an opioid, they'll give them a shot of Narcan. I think it goes in the chest. And to kind of restart their heart and kind of reverse the effects. That would be, I think, the best example I could think of an antagonist. And so substance abuse disorders are a really, really tricky categorization of disorders because there's such a strong physiological component. And like all other disorders, there are physiological components, but this substance use, it's been demonized in a sense. So it may be hard to get people to open up about their substance abuse issues. So again, it's figuring out which therapy works best for this disorder, for this person at this point in time. So remember that as we progress through, and maybe, developing a little more empathy for these problems, because yes, people choose to take a substance, but a lot of other people do too, and they don't have the underlying diathesis or stressors in their life that may lead them to develop an addiction. So practice a little empathy, and I can't wait to see your discussion boards. I hope you all have a great week.